British Columbia needs to increase its public drug coverage. Patients in British Columbia don't have public drug coverage of the medications they need. BC covers fewer drugs than other provinces and is often the last to provide access to the drugs they do cover. Through our public drug programs, patients across Canada benefit from coverage of prescription medicines for injuries, infections, chronic diseases, cancers, and many other conditions. These medicines can keep illnesses under control, reduce symptoms, cure disease, support health during aging, and prevent complications, hospitalizations, and even death. Before a medication is covered in a public drug program, it undergoes complex national review processes to evaluate its evidence and cost-effectiveness and to manage its price. Publicly available evidence clearly shows that BC, our third largest province by population, is underfunding its drug program compared with all other provinces and territories. BC's budget estimates for drugs are modest, representing a mere 5.6% of the total BC healthcare budget. Since 2017, funding for drugs averaged an annual growth of only 1%, compared to hospitals at 4.3%, physicians at 4.6%, and the other institutions at 5.4%. According to the Canadian Institute for Health Information, British Columbia has the lowest per capita medication spending in all of Canada. BC spends only $257 per person compared to the Canadian average of $442. While these low spending figures might be touted by the government as good fiscal management, what it really means is that patients can't get the medications they need. These cuts are harmful to the health of British Columbians. Also, when you compare the list of drugs that each province covers, called a formulary, BC includes the fewest drugs of all provinces. These are vital medicines that have gone through all of the approval processes, and most are covered in other parts of Canada. For example, between 2018 and 2023, BC refused to cover 31 newly recommended medications. By comparison, Ontario declined coverage for only 2, and Alberta for only 3. To better understand their impacts on patients' health, let's look at examples of novel medications that patients can access across Canada, but not in BC. DIGESTIVE is a Canadian discovery and the first medication approved by Health Canada for adults and children 1 year of age and older living with short bowel syndrome who are dependent on parenteral support. This medicine promotes regrowth of the small intestine in this complex and serious rare condition where a person does not have enough small intestine to absorb nutrients from food. It can occur when portions of the intestine are missing at birth, after injury, or surgery that removes 50% or more of the small intestine. Most Canadian public drug plans have covered this medication since 2018. Yet, in BC, these patients suffer as this unique medication is not covered. In mental health, Latuda has an approved indication for the treatment of schizophrenia and is covered in most other provinces, except for BC. It's an effective option for patients who have a contraindication or have experienced intolerance or lack of response to existing treatments. Reblozyl, for mild dysplastic syndrome, is covered in all other provinces except for BC. Dupixent, an advanced therapy for atopic dermatitis, a common condition, is listed in all provinces except for BC. Eraslo, a lotion indicated for the topical treatment of acne vulgaris in patients 10 years and older, and is covered in most other provinces except for BC. This is troubling since a significant number of acne cases occur in adolescents who have limited income and are developing a sense of self. Of particular concern is that BC refuses to cover most innovations in dermatology, and many other examples exist. Of the new dermatology products approved through our national processes, BC listed only 25% of the products. By comparison, PEI was the next lowest, and they covered 75% of the products. For those living with psoriatic arthritis, BC is the only province that does not cover a JAK inhibitor such as Rinvoq, which provides a unique mechanism of action in targeting the disease. Multiple sclerosis, or MS, is a devastating and debilitating condition. Ocrevus is a biologic medication that is covered as an intravenous infusion in BC for primary progressive MS, but BC is the only province to not cover it for relapsing remitting MS. Kesimpta is also a biologic. It's a subcutaneous self-injection for relapsing remitting MS, and BC is the only province to not cover this therapy. New medicines offer patients opportunities to live a better quality of life across all health areas. This can include having better efficacy than current treatments, more tolerable side effects, providing a different way of targeting the disease, or offering a new mode of administration. For some, it's simply an opportunity to live longer. Yet, even with a growing and aging population, BC chooses not to cover these vital medications. What are patients supposed to do? Move to another part of Canada? Suffer without treatment? Go to the hospital and wait days for a doctor? Give up and die? When patients do not have access to effective treatments, the province is putting them at risk for increased symptoms, disease progression, hospitalization, or even death. Although the government's achieving savings by significantly underfunding the drug budget, these are easily offset by increasing costs from the use of other health services when patients do not have access to the medications they need. Patients in BC deserve to have equitable access to care like all other jurisdictions in Canada. British Columbia should provide patients with a variety of medication options, from those that improve quality of life to those that are life-saving. Other parts of Canada recognize this. By not providing coverage for these essential medicines, BC is letting us down.